Mitral regurg. Etiology, most of the time commonly MVP. So it's 20 to 70%. Ischemia, 13 to 40%. And of course, sa atin, rheumatic pa rin, and infectious endocarditis. Pathophysiology, you would have chronic LV volume overload. And eventually, you'd have compensatory LV enlargement, initially to maintain your cardiac output, your normal cardiac output. However, as the disease progresses, you would have decompensation, and eventually you would have chronic heart failure. If you have LV dilatation, you would also have annulus dilatation, and therefore you would have increased MRs. It's actually a vicious cycle. Hemodynamics of MR. Okay. We are now going to look at the atrial waveform. Okay. This is the normal ACV waveforms. But notice, the pathology here is that instead of all the blood goes out to the aorta, some of it goes back to the LA. Therefore, you would have higher pressure in the LA during ventricular systole. Hence, you would have higher pressure at the V wave. Kasi the V wave is during ventricular systole. Therefore, ang peculiar sa MR is a large or prominent V wave. Ito, sobrang laki. Mukha siyang aorta. Pero ano yan? LA pressure. Sobrang laki ng V wave. Ito, initially wedge. So, pinasok yung catheter, naka-wedge siya. Pero you would notice, this is your A, C, and V wave. So, ang laki ng V wave mo. Ito, V wave na yan. And then, as you pull it back further, mas nagiging prominent yung dicrotic notch. Because this one, the V wave, could also influence the PA pressure. So this could also tell you that the patient has mitral regurgitation. So it's very prominent again. Ito yung inyong LV tracing. Ito yung inyong atrial tracing. So ito na naman yung V wave nyo. Di ba yung V wave, ito katapat nung ventricular systole. Symptoms, you know this already. Kasi nagtatagal na ako nakakaya kay doktor.